Oh.
Actually, already.
Electronic.
There he goes.
Yeah.
So it's Wednesday, November 5th, 2025, 1:30. We're here for the Benton-Franklin Health District Special Board meeting. I'll now call the meeting to order. And start with the review and approval of draft 2026 fee schedule. Kyle Phillips and Eric, forgive me,
Also thinking.
Elsa, thank you.
Great. So hello again, everybody. We have a few adjustments to our fee schedule for 2026. I know you guys had a list of the fee schedule items that are being changed. This is not our full fee schedule. These are just the few items that we are updating for this year. First, land use has a added fee for existing system evaluations. And this will be used when they do not do a full property evaluation. So it's a little bit less of a price and a little bit less for the homeowners on that one, the property owners. We also have a new fee for test holes, and this removes the permit component. So it's just test holes on a property. In case someone wants to build, they can do test holes and see if it's viable.
Thank you.
The pool program increased their fees by 15% across the board. This has not been updated for a number of years and is a flat increase. This only increases the revenue in that program by about $12,000 to $15,000. So it's not a big increase, but it is going to help cover the expenses of the staff working in that program. We have added some new clinical fees to the fee schedule that were not included in the past. These are billed to insurance companies and are set at their rate of their whatever they're going to pay is what we put into our fee schedule. So those are just added for transparency. There's new fees for immunization records. These will be for out of country and out of state records requests. So if someone comes in from out of state or out of country and they want their immunization records, it takes time for our staff to input those into the system and print them out their immunization cards. So the fee is $5 and $10 for those. And yeah, and I will turn it over to Lauren to talk about the fees for the public records requests.
Okay. So there's a couple of line items towards the bottom. This is something that all of both Benton and Franklin counties and all the cities have is an option to charge for public record requests that are not immunization records. Those are personal medical records. That's any public record that our agency has control of. And we decided not to do a cost study the way the city of Kennewick did. We went with what's called the statutory fees, and those are listed out in the Public Records Act. And the resolution that I will be reading in just a little bit speaks to that. Because according to that act, we need to have a separate resolution specifically stating that we would not do a cost study. And so in general terms, that's 15 cents per physical page that needs to be copied. 10 cents for electronic files, which is typically what we send. And then if there's any physical media like a USB drive or a CD that we are asked to put records onto, then it's charged at cost for those, which we haven't done one of those yet. We do reserve the right to waive any fees that are below, currently our policy states $5, just because it would cost more for our staff to create an invoice and charge the requester. But the public records officer, which is currently myself, also has the right to waive fees in individual circumstances as well. Any questions?
Questions from the board on the fees that are proposed?
I have one, but I'll wait. See if you guys have anything.
Go ahead.
How does this, so on the outline, everything you have on here, I see there's some services that have zero fee, but there's going to be an increased fee. Bottom line, with all the increased fees, how does that have what kind of impact does it have on whatever bucket that you have per se, or how does it look for the overall budget?
For the overall budget for
It's not a
this,
whole lot, but is it helping? It doesn't seem like a whole lot.
it's not a whole lot for
Yeah.
this fee increase. Our main spot was the pools. The other immunization fees, they're getting charged. We're just putting them on the fee schedule for transparency to
Okay.
let people know that we are charging that fee. It's just not on here before, but we are charging that to insurance companies only, not to clients if they don't have insurance. So
Okay. No, that's right. Perfect. That's what I was wondering because I'm looking at, I'm like, okay, makes sense. I like the transparency part. It's good.
So after going through the fee schedule on everything else that's not being adjusted, I would like to see what the justification are for some of these fees. Saw in here, what was it? Septic tank, plan reviews, 1,500. That's as much as buying the whole tank itself. I honestly, I think we need to have a workshop and go through and find out what all the justifications are on all the fees. That's my opinion. The state, they send you, was it foundational monies for certain programs?
yes,
You know, and where are those monies being spent? Because a lot of these things, like, you know, if somebody's doesn't want to come in and get tested because they're going to have to pay a fee, doesn't that have that responsibility should probably be, I would say, covered by the state.
So the FPHS funding though is not to supplement our fee for service programs.
Okay.
There are certain aspects of the OSS program that we can utilize FPHS for when it comes to education. And I know that we are doing that already, but it can't replace or supplement what you're looking at.
Okay.
Mr. Chairman,
Yes.
this is Commissioner Didier. I finally got through. Usually I can just click on and it takes me right to the meeting. But I went through quite an ordeal today to get on this meeting. But I'm in agreement with you. I'd get a couple comparisons, and that would be the garbage collection. When the garbage collection gets too high, people just start throwing their trash out on the road. On card tabs, when they get too high, they could quit buying them. And if people got to pay on HIV and other diseases to be tested for, they're not going to come in. And so our health district is failing the community to keep it safe.
Okay.
So I know that was one of your questions, was the FPHS, where we can utilize that. Was there another?
Well,
Or you
like I
want
said,
to-
I just think we needed an overview of all the fees. It's, I don't know. Apparently I haven't looked at some of them before, but they seem kind of high.
Okay. I know that the OSS ones were just, I think, reviewed and approved last year. I know there was discussion that we went through and talked about the formula. We had Jody here. We'd be happy to bring the crew back and we can talk about the OSS fees. Is there any other areas you'd like to take a look at?
Are we talking like the blood draws, HIV tests? Is that one of the things that Commissioner Didier was talking about? So, from like $0 to $7, $0 to $9, those type of things. Is that one of your concerns?
Currently, there's no charges on a whole list of them here, and they go down.
What happens if
They
they
go
don't?
down the list. The current price is 0. The proposed is 15. The next one is 0, 15, 0, 40, 0.
Blood draw 6 or 0 to 7. So what do you do when they don't have the ability to pay?
So the STI clinic ones that are listed here that had a 0 current,
Yeah.
those are all billed to insurance and not to the client
That's what I
themselves.
thought you
So,
said earlier.
yeah, if they don't have insurance, they don't get a bill for it. It's just a service that we provide that we pay the cost for. But if they do have Medicaid or an insurance, then we bill it to their insurance and the insurance pays it. It's just getting put on here for transparency.
Which a lot of people are under that qualify,
Right.
you know, especially to be honest with you, they're homeless. A lot of people do qualify, they're homeless that have Medicaid. So do we want that to help cover the cost of what they're running for a business, or do we want just not to charge them anything and then they potentially can eat it? Does that make sense what I'm saying, kind of?
Mm-hmm.
Yeah, on a financial basis, I'd rather have them, if there's a possibility of them to go ahead and get charged to Medicaid, because a lot of people are on Medicaid, then at least we're getting something to help the operational costs where it's not so expensive. It's not a whole lot. That's why I was asking earlier. It's not going to cover your operational costs.
No.
But it does help a little bit.
Right.
Well, some of the fees, I think, that are in the public interest, I think the health department should bear half the cost of that. So if, I don't know which one to pick and choose here, but,
Yeah.
Somebody came to you and requested a service from you, and you had to drop what you're doing to take care of that service, whatever it may be, that I could see charging them for that fee. Now, if it's something in the public interest to where it's gonna help the community as a whole, maybe they pay half and the health department picks up the other half.
Well, when it comes to vaccines and testing and stuff like that, once again, if Medicare is going to cover the cost, if they have that, it's a no-brainer to me. We should have that. That helps operational costs. It's nominal, but it's not going to do much to move the needle, but it is something. And also, when you're reducing operational costs, as you know it, then we're getting closer to being fiscally responsible with those means. If it's something that you talked about earlier, and that's one I did catch you said that you did say was the $1,500 for a septic. Those things like that, if we want to talk about that caught my attention. What you said, why is it that amount, and what would that, and why's the reasoning behind that? And if someone could answer that, I'm cool with that. That makes sense
Well,
to me.
I would like to see more justification on why the fees are what they are.
Yeah.
Because if
On all of
I'm
them,
gonna put
you got to pick and choose, because I'm not going to sit here all day for 3 or 4 or 5 hours to go ahead and go line item by line item on stuff that's common sense that Medicare is going to cover. Not
You
going to
got
do it.
4 pages here. of
I'm not going to do it.
You're not gonna do it.
Not when you're talking something that covers Medicare.
Free.
That one.
So it's okay to charge them, but if somebody doesn't qualify, then you're just gonna do it to them for free.
Right.
To me, that almost
How
seems
are-
like a
But
scam.
how are you gonna, what choice do you have? You tell me the choice. If someone comes in here and they don't qualify for it, and they don't have Medicare, and they're gonna cover the cost, that's part of an operational cost that's already built in. That's built in to the expenses of the department. But if they have Medicare and they're homeless, and a lot of them do have Medicare, am I wrong on that?
Okay.
Then why would we not cover that to keep our operational costs down? Because otherwise it's going to come out of the operational cost of running the business, running this organization. To me, it just,
Who pays for the Medicare?
the taxpayers of the United States government.
Exactly.
But at the same time, so what are you saying is, do you not want to charge any of that? You want it to be zero for everybody, and our costs go up here in the county? Because our costs go up in the county as far as operational costs if we let everybody have nothing for nothing. With the cost of employment, with the cost of utilities, with the cost of running this organization, our costs will go up, which means it's costing everybody.
Okay. I would like to see justification. Let's just pick the septic tank one. Septic tank plan review, $1,500.
And I'm good with you on
The
that.
tank costs $1,500. Why should the permit a plan review? I mean, I've put in enough septic systems. I can look at a plan and go, yeah, I can build that, I can do it. I mean, I don't understand if they've got the perk test and they've got the drawings, how long does it take? Does it take $1,500 worth of time to look at a plan review?
So typically, Commissioner, we don't present fees to you guys where it isn't bringing us to a net neutral. In fact, I already know that we're already operating in the red, coming up into the second year because we just approved them last year. Workforce costs went up, so we're going to operate in the red this year. But we didn't bring anything to you guys previously that wouldn't at least put us in the black to break even. And we can't, by statute, overcharge than what the costs were occurring. But to your point, I think it would be good to have some transparency about how we calculate those formulas, so you can see that. But I want you to have some level of reassurance that we aren't profiting off of this. It is recovering the cost of doing that work, but we can definitely demonstrate for you what that work looks like.
One thing too for me, like I'm fine with this because like I'm on the Benton-Franklin Clean Air Agency, and they're working on having to basically, okay, you're doing a house remodel that's built in 1915 or 2015, whatever. Okay, you still need to do an asbestos test because of state requirements, to where they're teaming up with the county and they're teaming up with the cities to where, okay, hey, I want to go get a demo permit through the city, and then the city will give them a heads up, to where I think too, if, okay, hey, you want to do a pool, just give me a heads up, this is what's costing, to where I think I'm fine with this as long as they know what they, need to do, then they approve it and they know what they're getting charged, to where if, okay, I don't want to do a pool, then they, you know what I'm saying? So I this makes sense what you're needing to do, because like what you're saying, we're showing that we're not, it's basically we're doing this at cost to make it to where we're not making any money really, we're just breaking even basically.
Right.
So it makes sense what you guys are doing.
Yeah. So this is the OSS one in this example is already approved, so it's already been active for this year.
I saw that.
But what I'm thinking is those ones that you want to take a closer look at, we can definitely we can bring that back for you guys. If there's some other ones you want to flag for us to further explain.
And I'm okay with that. Like I said, the one that you brought up, Rocky, I'm not educated in that, so that's something that is concerning, and I don't have a problem learning that and knowing that, because I'm not in that world. So those things like that, if you have something that you're flagging, or any of the commissioners, I'm open to that, because that helps educate, so we can make a better educated decision. I have no issue with that. But I know a lot of those things on that side.
And again, yeah, just as long as, okay, hey, you're getting a permit, just give me a heads up, this is what it's going to cost, to where it's not a surprise for the people that are doing it.
Agreed.
So that's why I'm fine with this, because it will help out and stuff. So
Yeah.
So is there other ones you'd like us to bring back and have it?
I would need more time to
Okay,
go through it.
that's fine. That's fine. You can always email it to me too. The ones you'd like to see. So the ones that we are proposing today, the one that Warren provided you that handout, do you guys have any questions on those ones?
I'm fine.
Yep, I'm good.
Actually, is there anybody here for public comment, or is there anybody online for public comment? Because I didn't see public comment on the agenda.
It's a special meeting.
We have one that.
But so there's nobody here that wants to comment on it? or
It's a
anybody
special
online?
meeting, there's no public comment.
There's not.
We can always ask for those that
Maybe we
are
could.
listening in.
I think as chairman, I have the right to ask for public
Certainly.
comment. But if there's no one online and nobody here for public comment, then at least the opportunity was presented.
So Lauren, do you want to ask?
It's okay. If you're online and you would like to make a public comment, you can raise your hand in the Zoom app, or if you're on a phone, you can press *9 to raise your hand.
I'm not seeing your hands raised.
Will you scroll back up, Tom? Just make sure.
Okay, so there's the others.
Yeah, most people know if it's a special board meeting, it's not going to have public comment, so I don't know if anybody would even come on if they did.
So I'm not hearing any public comment. Is there any more questions?
I do have one for the finance.
Yes.
The finance. I don't know if you're a finance director or finance manager. What's your title?
Finance manager.
Finance manager. Based off the information you got in the new adjustments of the new cost, how does that affect? I mean, do you feel comfortable with it on your department? That, like I said, I know it's not going to go ahead and cover that much operational costs. It's basically just trying to do it at a cost to manage your debt.
Right.
Do you feel good about this? Where are you at on it? Because, you probably have a background in finance or in accounting. Mine's in finance, but yours is probably in accounting. So I always like to know the guys that have the T transactions for debits and credits. Where you at?
So for the fees that we've provided here, even though it's a minimal increase, it does help to cover the cost of the employee for that program. So
Okay, so you got your FTE that you're trying to cover the cost.
Yep.
Okay, thank you.
Again, this makes sense for me. I'm fine with it because, again, they're doing the permits. They know what they're getting charged. It's not a surprise, and it makes sense why you guys are asking for this increase to help pay for it, to where the counties aren't having to get more money to you guys. So it does make sense.
Yeah.
And if you're trying to cover the cost of an FTE, which is expensive, this is a way to do it. Otherwise, it's gonna come out of, it's gonna be a challenge. One way or the other, you're gonna have to find it somewhere.
Yeah, and we kind of dug ourselves out last year, right, from not increasing fees for several years. And so hopefully this will keep us refreshed and on pace with increasing costs for staff.
Is it out of normal? I don't know if you guys know this, if you've done any comparables from other like counties. Is this out of the norm, or is it pretty normal for them to have the same kind of, fee schedule that you guys have done?
Yeah, so we've actually done some research, and I'll let them speak to kind of what they've done, but every single time we go through a fee review, the leadership is polling with other LHJs. And we're not just kind of stacking up against the west side, it's also trying to find like-sized.
Yeah, makes sense.
And geographically, it makes sense to where we're at, and then they're also working to understand formula models. Believe it or not all LHJs have the same formula model.
Yeah.
So the system is actually trying to get more consistent with that. One that we learned about, I thought it was interesting, I'm not sure if there's going to be a palette for the board, but was essentially we only increase fees when staff costs go up. So that the board has a level of reassurance that if the CBA and COLA goes up, proportionately fees would go up. And that's just
To counterbalance it, yeah.
Yeah, that's one example, but we've been working to try and have consistent formulas for all of our fees.
One thing to add to that too, real quick, so we can make a motion on this, is
Yeah.
being a builder, there's been multiple cities increasing their permit fees because of the same thing. So it makes sense why you guys are asking for this, to help cover costs. And it's not like you're wanting to be millionaires, but it's just, help covering costs on expense and everything to where we're budget neutral.
Yeah.
And like for me doing a project in Walla Walla, Pasco, Kennewick, some other cities, the permits have gone up a lot more than what they were a year ago or 5 years ago. So it makes sense what you guys are asking for because it's helping out the cost. So I'm fine with this.
Yeah. And I'm with my fellow commissioner here. We have worked hard on our commission side to, reduce the tax burden. We work very hard on that. And like I said, we're not doing the county levy tax. We're not doing the road tax this year. So we try to do a balanced budget. We're trying to do it in a more really meaningful, impactful way. But at the same time, I know when you have, I didn't know that until I went to a homeless shelter in Spokane, that how many people are actually on Medicare, those type of things. So if that's how we have to work within the parameters to move things and move the needle and cover our FTE and keep our operational costs down, it makes sense to me too.
Yeah. There's also a factor here that being by county, we get to share the costs of what it would be to provide that service.
Yep.
When we were, there were some discussions previously about the splitting, and I went back through and I looked at the costs for the county. So we look at county contributions and the populations. And Franklin County, it was a $1.46 per year per person for public health services, and then I think Franklin County was hovering right about $2.25. So when you look at the ability to consolidate services, to be able to have low county contributions, maintain the middle ground with fees, I feel like we're pretty self-sufficient and reliant in trying to
With the shared services, yeah.
Yeah. So, look, guys, was there anything else you guys wanted to add to that, kind of how you take a look at fees? Commissioner Alvarez's question.
Yeah, I mean, I can add a little bit, speaking to like the on-site fees, right? Last year, Jody came, brought a presentation. Janae already alluded to one of the evaluations that we always do is compare to other health districts, both like size and health districts across the state, to comparable fees, just to make sure we're kind of within a reasonable range. But we also have staff do time studies. So if we're evaluating a specific service, we would have staff tracking their time over a period of time. How long does it actually take you? And that fee is inclusive of our clerical time, the time to bill it, the time to apply the service, or travel time, everything that goes into that. We always try to stay cognizant of where we may be overcharging, right? You'll see two things on the fee schedule this year, both the existing systems evaluation fee and the test hole fee are fees that we've been receiving a lot of people asking us for test holes, just standalone test holes. And we don't want to have to charge them the whole $1,500 permit fee. So we're trying to say, okay, let's establish a lower fee so we can go out, a fee that matches the service we would be providing. Same with the ESC fee. We noticed that there's a lot of existing systems evaluations that we could evaluate on paper in the office. We don't have to go out to the field, look at the tank, look at the baffles. And so we're proposing a new fee at a much lower rate so we can provide that more streamlined service. So we do try to stay cognizant of not overcharging.
So you're looking at micro level as well as every little bit that's creating to go that route, from the smallest to the largest. Okay, that makes sense. Thank you.
Is there a motion?
So you.
Yeah, if there's no more discussion, I'll entertain a motion.
Okay. I move to approve, approval of draft 2026 fee schedule.
I'll second.
A motion and a second. Any further discussion? All in favor signify by saying aye.
Aye.
Any opposed?
Nay.
Nay. I didn't hear yours.
I don't
I don't think she
think
can
that I
outvote
can vote
it,
on this. That's me abstaining.
So we have 2 for and 2 against.
Lauren, do you know what the bylaws say about tiebreaker?
I'm pretty sure it's the chair, but I'll double check.
So what was the cost when you broke that out separately? You said 146 and 225. What was the numbers for Franklin, Benton County? 146 per person, or was it the opposite?
No, it was the 225.
225. Okay, I'm just writing numbers in my head right now, strategizing down the
Yeah,
road.
and that includes, so that's your guys' county contributions plus your NFP.
No, you said Franklin County's was 225.
You know, yours is a 146.
146. Yeah.
Okay, so I'm in the section I thought it would be in.
I think it is a chair. If it's a tie, it's the chair.
Yeah, but I've already voted.
Yeah, no, that's what I'm saying, like it.
Whichever way you voted is the tiebreaker.
Yeah, the way it goes, yeah.
So then it would go back to the board for discussion.
After we get through all this rigmarole, what we got to do right now, and it has to come back. I definitely want on the record why you would be against it. That discussion down the road. I definitely think that should be. I want to know
No,
why.
I don't think we have to justify our vote. Either way we vote.
If we have to go through, so let's say the chair votes nay again, then this is a dead deal. Is that correct?
The motion dies.
Okay.
And then we're back to understanding from the board then how they'd like us to reconcile the budget. I think it would help us to understand if the board is willing to understand what the needs are and why, that there's opportunity for us to
Fix it.
fix it or explain or bring more information back on these proposed fees. We'd like that opportunity. Lauren, do you have the bylaws?
Yeah, I'm looking at it. I had to convert it to OCR so that I could actually search it because it's not in the section I thought it would be in. It says that the chair is an equal voting member, but I'm trying to find where it specifies ties. Members. Sorry that I saw that it was, the chair was the tiebreaker. I looked at these before.
Well, I know that you can probably keep looking at that. What does the board want to do in terms of next steps?
I mean, if it's, if the motion has failed, then it's gotta come back for further discussion on this item.
Yeah, so I'm coming back to you and saying, where would you like to go next to continue discussion, since we're in the middle of budget prep?
So it's something we meet again then on, or?
I'm looking to you guys, like we can have discussion, or we can bring something back if there's more information.
For another meeting, or?
For the fourth one.
Yeah, I'm looking to you guys in terms of, we've presented, if it was a failed motion, I'm coming back to the board now for direction, because we have to be able to balance our budget.
And I guess I haven't been somewhere where the motion has failed and it has to come back again. I don't believe it's something we just keep running until it passes.
No, it's the new topic on the table is, since the fees did not come to pass, we're going to be in a position of not being able to afford some of these services.
Okay.
So that's what I'm bringing back to the board, since this is unprecedented for us, where we've had the board is not supporting the ability to continue to provide the services at the same level, how you guys would like us to proceed in addressing that deficit.
Well, I would think you'd have to come back with where you're gonna cut your budget at.
I guess my question is it something that we could, say we approve it and we try it out for a year? Hey, we actually are under budget or we're over budget, to where the next year we change it, because it makes sense with how you guys are doing this, to where it's covering cost for everybody doing this stuff, to where, okay, hey, next year we can actually cut this by a quarter or 8% or something, so it makes sense. That's why I voted yes on this, because I would say try it out for a year, and then if it, again, a year from now, hey, we're way over budget, or actually no, we broke even with this, so that's what I would recommend.
My nervous part is we may even go the whole more the way if we run this, because healthcare costs are continually going up, and we're now they're going to have to pay catch up.
Except for people's wages.
Pardon?
This is everything is going up except for people's wages.
No, minimum wage went up.
Yeah.
Like, so way higher than
So
Idaho.
So
Yeah.
we're only going to end up having to pay catch up. We're just delaying that.
The only person that benefits from raising minimum wage is the government.
But do you see my point, like what I'm trying to get at though?
They do.
That's what I'm like, it would be great if,
But if the taxpayer can't afford it, what do you do for them?
well, no, it would be the person
So-
that's doing the permit, is what I'm saying, like to where, okay, hey, it's gonna cost me X amount of dollars to do a pool, to get the pool inspection, okay, I'm not doing the pool. That's what I'm trying to get at is where I'm fine with it, because they know exactly what it's gonna cost and it's not a surprise to them. And so again, like I said, it makes sense to
I think
say yes.
pool is a luxury, but a septic is not.
But it's still, I know, but
And a
it's
septic is a public safety.
correct. But again, building a house, like I have one of my project managers building a house up in Connell. He knows exactly what he's having to pay for, and he's building a house. So to me, that's what I'm saying, is it makes sense. It's not a surprise to.
It's not a surprise, but it does raise the cost.
Commissioner McKay, I
It
think
does, yeah.
I agree with you 100%, but I know we're not getting anywhere on this one. I know what's going on, I feel, and I think that you had the chair give direction to staff. I say just roll with it. Let's move on to the next one.
Okay.
I will give one clarifying point. The pool fees are for recreational pools.
Yeah.
So like hotel pools that need to be inspected to make sure that they're up to the standard for safety.
Yeah.
That's what these fees are for.
Yeah,
So
no, that makes sense.
not home pools.
Home
or anything
pools,
like
okay,
that.
yeah. Because I was gonna say, I built my home about, 8 years ago, and I never really had to have you guys involved, so it makes sense when it's private, yeah, that makes sense.
Just public pools that can be inspected.
So I'll entertain a motion for approval of resolution 25-04.
Well, so that's actually tied to the fee schedule,
Yep.
So
so
we can't do that.
they'll have to wait.
Date of the next meeting is December 10th, 2025. For the business, this meeting is adjourned.